Toby Cosgrove there saying that in order for there to be real progress on healthcare reform, healthcare policy, this bill has to fail. I wonder what you make of all the back and forth. What's motivating the conversation in Washington right now when it comes to healthcare?
I think the bill in the Senate is starting to move in the right direction. And they're thinking that we can talk about public policy and anchoring on that. And they're trying to, and I never count Mitch McConnell out. I mean, the leader has been doing it a long time. And I think he's trying to coalesce and bring together a group, but they are moving in a direction that is sensitive to the vulnerable population, which they need to do. Now, if the bill did not make it, well, that's another alternative. I think we'd have to sit back and regroup, and they would have to as well. You know, and typically social reform, social legislation tends to have some of each side involved. But in this case, they're moving it ahead, they're moving it aggressively, they're moving in the right direction.
From where you sit, normally in St. Louis or here in Sun Valley this week, do you see the same problems with the healthcare system that the president does? He talks about it being in crisis or Obamacare failing. Is that rhetoric measured? Is it accurate? Does it reflect the way healthcare looks to you from where you sit as the head of an insurer?
The exchange program, the marketplace, we've been very successful with it. We just added 4 new states, and expanded those we're in. We went from 500,000 lives to over 1 million lives, and we'll increase that in 2018. So we find it to be a very successful program.
What is it about the way that you approach healthcare, health insurance, that makes it a success for your company? How are you doing things differently than the other major insurers?
Well, I think we have the right network. We're looking at our population that we serve. The network is structured to deal with them. The pricing's right. We have subsidies. 90% are subsidized, which is important, so they can afford it. They're learning how to use insurance, and it's just turned out very well. Those who move off Medicaid are then able to move into the exchange and continue with the same network, and it's been very successful.